Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined by a very special guest with a really interesting career, Joel. And Joel, can you please introduce yourself and your role?
Sure. Thanks, Cole. Joel Tompkins, and I am the CEO of Lassie Health.
It's so great to have you on. You have a really interesting career. You've had a very fast kind of rise. I guess fast, not necessarily in terms of without hard work. You've done a tremendous amount of hard work, but it is impressive the amount of transitions you've made just looking at your resume because you started as a nurse, right? And then a nurse anesthetist, and then kind of gotten all the way up. But how did you start off exactly? What got you into the healthcare field? What got you into patient care to begin with?
Sure. No, yeah, absolutely. It started my career as a nurse, and from almost a familial history. So my mom and dad are both actually nurses, so I knew about the nursing profession. Albeit my dad actually transitioned into a business role in the interventional cardiology space. But when I was, finishing up high school and trying to figure out what I was going to do with my life, I realized that, going to college for me wasn't about getting a degree and then trying to figure out, what I was going to do. I actually wanted a degree that, gave me some purpose, and nursing certainly fit that role. But I also knew that it opened up an amazing amount of opportunities to do pretty much anything and everything. And that's the best part about, I think, being a nurse is it's a foundational degree that allows you to provide patient care. But then after that, you can do a myriad of other things. And about 3 years into my nursing career, which at the time I worked in intensive care unit, coronary care unit, and then actually a cardiac cath lab. I decided to transition and go back to school to become a nurse anesthetist. And that was actually really from a friend of mine who called me and said, "What are you doing?" And I said, "I'm just working." And he said, "You should go to anesthesia school." And I said, "Okay, that sounds pretty good." So I ended up taking the graduate record exam. And then a couple of weeks later, moved to Pittsburgh. So where I attended anesthesia school at the University of Pittsburgh. Had great training there, and ended up actually meeting my wife at the University of Pittsburgh, and then moved to Saginaw, Michigan, and our oldest son was actually born there. We ended up moving back to Northeastern Ohio. I was from Pittsburgh, where kind of led me to my next iteration of my career. I ended up starting an anesthesia group with a friend of mine, and fast forward a few years where we were kind of growing that group, but we were also doing, all of the work. So we were working, 80 hours a week in the operating room, and we were doing payroll and billing and all the other associated things with having kind of a small business. And in 2010, we ended up, one of the hospitals that we were covering actually had multiple anesthesia groups covering it. And a group out of Texas ended up bidding on that hospital and kind of winning the whole entire bid. And that company is called Mercer Anesthesia. At the time, I met the two principals that started the company, and they said, "Gosh, hey, we'd love some help with this hospital that we just won in Ohio, where we have no business, and we really don't know the market. We don't know what the compensation should be, and we have no providers. I think 17 CRNAs in about 90 days." And so my partner and I helped them transition that facility. And at the same time, we were still getting, opportunities, put forth to us in our own group to be able to grow our business. And we made a conscious decision to pivot, because we were at an inflection point where we either we're going to put a lot of money into the company to be able to grow it from the standpoint of working capital. And at the time, we said, you know what, let's just help try to bring some of this business to North Star. So became an employee of North Star at that time, and from 2010 to 2013, really kind of grew the business in the Midwest, in Ohio, Indiana, Pennsylvania, Illinois, parts of Michigan. And then that led me to kind of 2013, where I had a bit of a pivot because I was doing a lot of still in the operating room between 20 and 30 hours a week. And also, administratively kind of managing my own P&L across the Midwest. And we actually had a private equity transaction in 2013, brought in our own, or kind of our first probably professional CEO. And I had a conversation with him and said, I need to kind of either go one path or the other. I can't continue to do both. So in 2013, I pivoted more to a administrative role responsibility where I was the general manager of what we called the Midwest. And I became VP of operations and then SVP of operations, then chief operating officer. That led us all the way to about 2018, where we had another private equity transaction and became the chief client officer and then eventually the president of the company. And that took me from about 2010 to 2023, late 2023. And then, I had the wonderful opportunity to, with a group of other healthcare folks, start Lassie Health. And that's how I got to where I'm at.
It's pretty impressive, right? Like this is not, an easy thing to accomplish. And I guess what's really interesting to me is you went from, clearly being an excellent clinician, nurse nursing is challenging, right? A CRNA school is challenging, and being a CRNA is very challenging as well. But then there's this business side of things. Like you mentioned, your father had transitioned into a business role, but how did you know how to do these business things, right? Like, I mean, how would you know how to start your own, uh, group? Like these things seem challenging in themselves.
It was, and it was, really on the job training for a lot of it. To be honest with you, you kind of figure things out along the way, and you make some mistakes, and you learn from those mistakes. And even post having my own group and transitioning into my role at North Star, that was a lot of on the job training. We were, when I first started, a what I would say is a large mom and pop anesthesia company that wanted to be a enterprise national company, and I was put in. I was glad to take the position of, hey, let's kind of figure some of this out along the way. So it gave me great opportunity to be able to learn managed care contracting and how to manage clients and how to look at financial reports and manage other people. So it was a great on the job training, and I'll be the first one to admit I made mistakes along the way, but thankfully I also learned from those mistakes. And you put all of those experiences kind of in your toolkit, and now you have, instead of one screwdriver, 1,000 screwdrivers to choose from, as you're kind of navigating not only healthcare but business in general.
Well, so you could have just said after one of these mistakes, I'm going to wrap up shop and just go back. Because I mean, CRNAs make a reasonable amount of money, right? And your wife is a CRNA as well, right?
Correct. Yeah, she
So
is.
dual income, you would not have been, destitute there, but you kind of kept pushing through these mistakes and you kept advancing. Why did you choose to do that, right? What is some of the qualities that you developed or the experience that you had that had pushed you to continue?
Yeah, I think perseverance is something that was kind of instilled into me by my parents, my mom and dad. Always been driven to succeed, and for me, the goal line always kept moving. I just kept either purposely or it was continued to be moved further away. And while I would advance, sometimes to the 1 yard line, the next day I realized, hey, I'm really only at the 20. And I think that's both probably an internal thing for me that I'm always trying to strive to be better. And at the end of the day, the other piece that I've always have been a big proponent of from a mental standpoint is always continue to learn. You have to continue to learn. And if you get to a point in whatever your career is where you say, geez, I'm just not learning anything anymore, then it's probably time to hang it up. So I've always, been of the mindset of, all right, you accomplished that goal. What's the next goal?
Nope, that makes a lot of sense. And so it makes sense that you had achieved this presidency level, right? Where you're kind of overseeing, near the top of the organization, and then you decide to go into Lassie Health. But even though it makes sense, right, because you're starting this new challenge with a lot more potential for upside, but also a lot more risk, this was not long ago, right? 2023. So at this point, you're a bit older than you were when you switched over and became CRNA. So risks might be a little scarier to some people as they, have more responsibilities. How were you able to take that risk, right? How did you decide to confidently go over and do this completely new thing? Because this is also a new area than what you had done before, right? You hadn't necessarily run a business like Lassie before.
No, totally different. Obviously, I've been in healthcare for, going on pushing 30 years now. But, I think, my family supported me, making a change. And, I have a 19-year-old, a 17-year-old, a 16-year-old. So, one in college and two in high school. And, trying to make sure that I was still actively engaged in something that gave me purpose. And, they supported me 100%. And, again, I've been blessed with being able to be a quick study on things. And so as I started learning kind of this industry, which obviously is healthcare related, but I had to do, a lot of deep dive into a lot of different, pieces and parts of what this industry looks like. And also, was blessed with being able to surround myself with a group of people that are on the team at Lassie Health that have a vast array of experience in different pieces and parts of healthcare and business that you're only as good as the people that you surround yourself with, and hopefully they're better than you, and I think a lot of them are. So that's it's been while challenging, it's also been eye-opening and exciting too, because I get to learn a whole slew of new information.
No, that's I appreciate that a lot because that's something that I believe very much is that the people are like the most important thing. And I love people who are smarter or faster or better than me in any way because it, gives me something to learn from, right? We can learn from each other.
Absolutely.
That's so important. So what is Lassie Health, right? Because,
Yeah.
we're familiar with your previous work. A lot of people know what anesthesiology is. They know what, these practices are, but Lassie Health is kind of completely different, right? So
It
how,
is.
what is it exactly? And then also,
Yeah.
why did you come to get involved with this? What was the inspiration? This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more.
Yeah. I'll start at the inspiration. So I've been a huge proponent of transparency in healthcare and transparency in pricing, for a long time. And that was, it's difficult when you're in the anesthesia space because if you do your job really well, people don't remember you, and hopefully they're pain free. And then when you work for a third party organization, like an outsourced anesthesia management company, a patient, an end user gets a bill, call it 30 or 45 days later, and it says North Star Anesthesia. They don't really realize who that was. They didn't know that Joel, the CRNA, worked for North Star. All they know is they, had someone put them to sleep, and they get confused, in those situations. So, if you kind of take that at a 40,000 foot view, and you think about healthcare in general, healthcare is the only industry where you don't walk into an electronics store and you see a bunch of TVs on the wall and you're shopping for a TV and you go, I'm going to take this 65-inch one. And there's no price on it, but you take it home with you, and 90 days later you get a bill for $4,000. And you, well, number one, it's a surprise. And it's the equivalent of you don't know that you had a $4,000 deductible because number one, the vast majority of people don't understand their traditional health insurance. And number two, if they had a procedure, no one's telling them in advance of what the potential cost is. In very few situations does it actually happen. You can look at the ambulatory surgery center space. They oftentimes will do a pretty good job of, running a 270, 271 transaction, which looks at the eligibility of the end user and they know what their deductible is, and they're going to try to give them, kind of a good faith estimate on what those costs would be. So, when we started Lassie Health, was truly to create a digital front door platform that's a membership plan that would assure the American public that they could have high quality access to transparently priced care. We are not out to replace traditional insurance. We think, in a lot of times, we can be an adjunct to it. Um, but when we created, Lassie Health, it's really to have a user experience that, independent on who's behind that digital front door that we have, our partners, uh, the end user has the same experience every time. And what it is it's transparent, and access to care, is paramount. I mean, right now, about half of people in the United States that they are saying that they have a difficult time affording healthcare. And we're spending $4.7 trillion on healthcare in 2024, with it going to over 7 trillion by 2030, is what the CBO says, Kaiser Family Foundation. That's untenable. That's not going to work for employers, and it certainly isn't going to work for the citizens of the United States of America. So we have to figure out other options that give people um, a choice. And what we feel is really important as well is you create the opportunity for the American public to be consumers of healthcare instead of users. We use healthcare today without understanding all of the different dynamics that can affect how much they spend for something or don't. And when we transitioned from um, you know deductibles of $500 up to now 5,000, 7,500, and out of pocket maximums that are
Yeah.
$12,700, when that needle started to move, really, we thought, geez, we'll bring in HSAs, and that's going to make people actually utilize their health care dollars more like a consumer. Well, not if people don't understand how to do that. And we never gave people the opportunity to understand how to do that. And so, what we're trying to do is provide that opportunity for people to say, hey, maybe you do have health care or health insurance, but how can we give you access to something that's going to say, here's what your cash price would be for something. Here's a very cost effective membership plan at $30 that gives you access to virtual urgent care, virtual mental health, 100 generic medications, discount programs for labs and imaging, and bundled payments for procedures, for $30 a month. The value proposition is there, and we see, I think it's like 40% of people in the past 12 months have pushed off some type of healthcare because they can't afford it. And if people know the cost of something up front, that gives them the opportunity to say, okay, now that I know the cost, I can either save for it, or I'm just going to, bite the bullet and wait, and to be able to pay for it. So that's what we're doing.
That's so important because it makes the economy very challenging for people because they can't plan, right? They can't plan out their future. They might be saving for a house, and then they have to have, a knee repair or something done, and then all of a sudden, well, now I can't get a house anymore, right? I mean, that's happened so often.
Yeah.
But what does the experience, I guess, actually look like? So let's say I was a consumer,
Mhm.
an average individual. Can you just walk me through what getting your service actually looks like?
Sure. Yeah. We have, a web-based platform. It's a SaaS-based platform where the end user can register, choose a plan. We currently have 4 different plans, ranging from, for an individual, $30 all the way up to $275. And once they register for the appropriate plan, they have a username and password, and they basically use our website and SaaS-based platform to be able to access pretty much anything they need. So you can search for a physician. You can use it to access to schedule direct primary care. You can use our platform to access, all of the aggregated discount cards for pharmaceuticals that we have, or access the free drug formulary as well. So they can access the virtual urgent care, or behavioral health, or their direct primary care that they can actually do via telehealth, our telehealth platform as well. So everything is meant to be accessed via our SaaS-based platform, and that's why we truly wanted to make it. I use that term "digital front door," and people use that kind of ubiquitously now. But that's really the framework that we chose, so that again, the end user, they don't care who the vendor is on the other side. They want that user experience to be the same. And that's really important to us as we think about expanding our offerings. Like I said, on the $30 plan and all the way up to, we have a health share and direct primary care for in-person care, because we know that you can't do everything virtually. And so we have to have access to in-person care from physicians, as well as the opportunity for those kind of large health expenses. You fall and break your ankle and need surgery, to be able to use a health share. We're actively working on a couple of ACA compliant plans, because we know employers are struggling right now. When Aon and others say, hey, at a minimum, there's going to be a 9% increase in premiums next year. And we've seen that. We've seen that for the past 10 years, where premiums continue to increase. And it doesn't matter, how healthy the pool of individuals are that you're insuring, your premiums are going to go up. And how can we create a platform where folks have another option? They obviously, you can look at kind of the Buca route, the Blues and Uniteds and Cignas and Aetnas, but give employers, and in particular, small employers that, let's say are more than 50 EEs that have to comply to the ACA, but they can't afford to do so. And so, we're really excited about the opportunities that we have to create ACA compliant plans that give employers another option that is, significantly cheaper, upwards of 50% premiums cheaper than, kind of your traditional route. And we think that's important to be able to, number one, small business is the backbone of the United States of America. We need to support those folks to be able to continue to be successful, and so that they can use those dollars to reinvest back into their employees and in their businesses, to kind of that trickle down effect of creating more value for not only the business but their employees as well.
And that's the problem for small businesses, especially, is a lot of the current options out there. They're so expensive and they provide so little for the employee. And if you want to attract top talent, they want you to have all of these, extra benefits. But even really expensive insurances, they do not provide nearly anything, right? I mean, you'd be lucky if half of them give you, behavioral, telehealth. I mean,
Yeah,
most of them, they give you behavioral health, but you can never access it, right? Or they give you a dentist, but you have to drive an hour to get to
yeah.
the dentist. So, I mean, I'm excited to see what those ACA compliant plans look like. I want to ask you a final question, though. You were successful in your career. You and your wife were, financially, you had a lot of responsibility. You had children. Why not just, ride out the next 20 years and retire, right? I mean, because that's what a lot of people would have done, right?
Yeah.
Why take this jump? Do you have a personal experience or something that really got you to say, I really want to change this. I really want to improve this?
Yeah, I think, for me, personally and professionally, one, I have to have a purpose. And this is a great purpose to have, is to, create high quality access to transparently priced care. And I have been in the position to be able to see every side of this equation, right? As a healthcare provider, taking care of patients, which is an unbelievable gift that is given to us as healthcare providers. But then also from the other side of it, as a patient, with or as a father of patients with my kids and different experiences that they've had, over the course of time with, accessing care, and then trying to follow the your EOB, and even being in healthcare, you have to learn how to look at an EOB and how to manage all those things, and then just the statistics of you know the vast problem that we have right now with the way our healthcare industry is managed. And when if a premium for an individual is $18,000 a year on average, and then they have their deductible, call it 5,000, and then their out of pocket maximum on top of that, that's, it's just not, it's number one, it's just not tenable. And number two, I was, given the opportunity again to start this company and hopefully make it easier for people to access care, make it more affordable, so that they don't push off healthcare, so that they can actually access the system. As we think about how healthcare is moving from inpatient to outpatient and hospitals to hospital at home, we have to create opportunities for folks to be able to access care. And we all know that there's, kind of these healthcare deserts out there for family practice and things like that. And, our mission is to make those things a heck of a lot better, for the American public and do so in a cost effective way. But at the end of the day, we all need a purpose, and I think our purpose at Lassie Health is to create that opportunity for folks.
Thank you for sharing that, because it's important to understand people's motivations, especially when we trust them. Nothing wrong, of course, with people who are providing for their families or whatnot, but it's important that we have individuals like yourself who are really dedicated to actually making like this big impact in the community. And it's such a big problem, right? I mean, here in Philadelphia, I see
Yeah,
this all the time. People who have insurance, they're also just confused, right? Like we know that the donut hole, like we had talked about before, they don't understand why in the middle of the year their drug costs, shoot up, and then now we're going to be getting rid of that, but it introduces other problems, and so it's
yeah,
just been a challenging system. And we need organizations like yourself who think about this a bit more logically, a bit more, kind of business minded, but with a consumer focus, right? Which is what you guys are doing. It's so consumer focused. So really appreciate you sharing your motivations and your career history with us. I'm excited to see those ACA compliant plans when they start
yeah.
coming out, and hopefully we can have you back on to talk about those.
No, I'd love to. Yeah, thanks so much for the time. I appreciate it.
Of course, great talking with you, Joel, and I hope you have a good rest of your day.
Thanks, you as well.